According to the National Institutes of Health, 1 in 4 people will struggle with a mental health issue at some point in their lives, and half of those who struggle will go undiagnosed. It's a stark reality, and it leaves friends and families with very little information about what to do. That's why the nonprofit organization Valley Cities offers free mental health first aid and training classes. Please welcome Valley Cities Program Manager and King County Mental Health First Aid Coordinator, Sue Wider. Good to have you here.
Thank you so much.
I like even saying that phrase, mental health first aid, because that is the thing, whether it's something that's happening to you or if you have a friend or family member in crisis, how would we ever know what to do? And this is the answer, this class.
That's correct. And we are offering them all over King County. Valley Cities is very committed to community, connecting people, showing compassion, and it goes right along with King County Department of Communities and Human Services that helps provide these trainings with public tax dollars. And this is because we want to reduce the stigma and to help people get interventions and connected with appropriate professional help, because we know that helps with recovery.
And this came about because of the need.
Because of the need, and it's a nationwide program, actually a worldwide program.
You know, and it's so needed. You think about the training you get, whether you're expecting a baby or, you know, how to recognize the signs of a stroke or a million things that we do to try to keep our kids safe during their sports participation. But there hasn't been anything that I've been aware of that's been widely available to help people recognize some of the more common things like anxiety and depression, which seems to be, you know, running fairly rampant in both adults and sometimes in kids as well. Tell me what you're seeing.
So anxiety is #1 mental health disorder, and depression is #2. And there are all kinds of reasons why, but more and more people are experiencing that and don't really know that they are. They've always been this way. They didn't know whether to go get help. And culturally, sometimes that's not the appropriate thing to seek help.
Yes, there are communities in which this is more difficult. Good point. Is that addressed in the training?
It is addressed in the training. So our training will cover signs and symptoms of various mental health disorders such as depression, anxiety, panic attacks, psychosis. We talk a lot about suicide and how to assess for that. Warning signs and risk factors, and more importantly, an action plan. So if people think of CPR for mental health, so we have an action plan called ALGIE.
ALGIE.
ALGIE. And
perfect for us around here.
ALGIE is actually named after koala bear because mental health first aid originated in Australia and came to the U.S. in 2008. So with that action plan, it teaches people what to say, how to say it, and how to connect people with the appropriate professional help.
So what does ALGIE stand for?
ALGIE is assess for risk of suicide or harm.
Okay.
L, listen non-judgmentally, which is much harder than people think.
Yes.
Give reassurance and information, just letting people know, you know, you're not the only one that has felt this way.
And we can get help.
And you can get help. Give information and appropriate professional help, and support strategies and other support things.
So that's just kind of a checklist that people can have in mind.
Right.
Now, do people come to this class with no background in this, or is it often because they've had a family member, they know that anxiety runs in their family, and you just kind of want to get prepared?
Most of the time people say, I have a daughter, I have, my husband is suffering, my neighbor, I want to help my neighbor, I want to help my friend. So for the public trainings, a lot of that, it's curiosity. And it is an 8-hour training that each participant will receive a 3-year certification.
Wow.
That will allow them to help someone in crisis.
And I'm wondering, just would this be useful for teachers, parents?
So there is a youth curriculum as well. So a lot of the schools do want their staff and teachers to take that class. So we do offer the youth mental health first aid training, and that's for anyone that's working with students,
Right.
11 to 18, but that's for parents, coaches, recreation people, any of those kinds of people.
Because the more trained eyeballs we have on kids, the
Exactly,
better. And
yeah.
people used to think you didn't discuss suicide. You didn't ask anybody if they were having thoughts of suicide or had made a plan or any of that. But the advice these days is very different.
It's very different. You actually ask the question. And as hard as it may be, and we practice this because it's not always an easy, comfortable thing to say.
You're afraid of
or
the
ask.
answer.
You're afraid of the answer. So you say, are you having thoughts of killing yourself? And depending on what the answer is, you know, you find out if there's a plan, if they've gathered the things that they need to carry that out.
But if you do ask this question, you get that answer, then there's your opportunity to intervene and to help,
Exactly.
right? To offer professional help.
Yes.
And the certification that you mentioned, what does that mean? So if I have that certification, what does that mean
So it means
for me?
that you've received the 8-hour training and you're well versed in the training protocol and you are able to help someone.
Would that be, is that some sort of official designation?
That's an official certification that you receive through behavioral health counseling.
Okay, so you might work then at a helpline or something like that with that training.
You may be able to, yes.
Yeah, okay. What do you think the future is going to be for this? We have these mental health crises, as you mentioned, of depression, anxiety. We have substance abuse issues in families, and it feels like everybody is experiencing this with no information when it first happens in your family. What do you see in the future for us to be better prepared and educated for these sorts of things?
I think anyone that has an opportunity to take a training to do so, because you get information that is eye-opening.
Absolutely.
You think you know, but you don't know. I've had several people come to me and say, I had no idea that I just didn't know until I took this class. And one of our participants just recently was able to save a life. And he became very emotional over that because he realized that without that class, he wouldn't have been able to intervene. And he said, I don't know where the words came from, but it was almost verbatim from the class. So the language is very deliberate and we do a lot of repetition. So in a case of a crisis, it just comes naturally.
You'll remember. Thank you very much, and I hope this expands so that lots of people will be able to get this very important information.
Thank you
so
for
much. Mental health first aid training classes take place Thursday, September 6th at Shoreline City Hall and Saturday, September 22nd at St. Elizabeth's Hospital in Enumclaw. Please visit our website for links to these and other classes and resources. It's good stuff.